Puerto Rico medical revalidation style, a 68-year-old male with a history of hypertension, diabetes mellitus and chronic kidney disease stage 4 presents to the emergency department with progressive shortness of breath and bilateral lower extremity edema for the past 3 days. He reports non-compliance with his medications, including his diuretics. On physical examination, he is hypertensive, BP 160/95 mg/Hg, tachycardic, HR 98 BPM, and has jugular venous distension, JV bibasilar crackles, and 2+ pitting edema in both legs. Laboratory findings: BUN 55 mg per deciliter, creatinine 3.2 mg per 2.8 mg per deciliter, BNP 850 p/ml, ABG on room air, mild respiratory alkalosis. A bedside echocardiogram shows a dilated left ventricle with an ejection fraction of 35% and elevated end diastolic volume, EDV. Question: which of the following is the most likely cause of this patient's increased preload? A. Administration of excessive IV fluids. B. Congestive heart failure with volume overload. C. Severe anemia with high output cardiac failure. D. Pulmonary embolism with right heart strain. E. Acute pericarditis with cardiac tamponade. Answer: explanation. The correct answer is B. Congestive heart failure with volume overload. This patient presents with signs of fluid overload, including JVD, crackles and peripheral edema, along with a history of chronic kidney disease and poor diuretic compliance. CHF leads to increased preload due to elevated end diastolic volume, EDV, as the failing heart struggles to pump effectively, leading to fluid accumulation. A. Administration of excessive IV fluids would be a possible cause in a hospital setting, but is not supported by this patient's history. C. Severe anemia with high output cardiac failure typically presents with warm extremities, bounding pulses, and a hyperdynamic circulation, which this patient lacks. D. Pulmonary embolism with right heart strain would present with acute dyspnea, pleuritic chest pain, and signs of right heart failure, not elevated E. Acute pericarditis with cardiac tamponade would present with pulsus paradoxus, distant heart sounds, and a drop in cardiac output rather than increased preload.